schools, in offices, and your preferred choice in hospitals. Why is it a Herculean task? Because how can you merge medical treatment, that's basically allopathy, with herbal notoriety? So we now want to verify the interest. Is it needed for us to go through all these stories of trying to merge herbal and traditional medicine into the flow? Is it worth it? So we verify an interest and take one of the like groups, which is the Pax Herbal Center itself. Is the star of the Nigerian Midwest with the following statistics on students approved for industrial training from 2008 to 2017 March. As of that, they have 23 tertiary schools from all over Nigeria. They had 26 different choice courses. They spend a minimum of 6 months and a maximum of 12 months. They have paid tutelage stipends, emphasis, and they have a herbarium, a beautiful herbarium in which most of your students from all over Nigeria have said, because I interviewed some, they do not have a herbarium. And they're actually being trained in health-related courses that involves herbs. Primary, a classical subject with an entrance examination. So you can see the importance they have placed on it. Secondary school, a subject with questions they have to pass at an entrance examination. On the tertiary scale, all Jambites, irrelevant of the courses you opted out for, must take traditional medicine as an elective course that must be passed. But those in health-related courses will follow through to their second year in the university. After that, they stop. Now, those that now graduate, that are now interested in African traditional medicine, can now go through an extra diploma. The third tertiary is the veterinary school, those that are going to manage the animals. A 4-year electives, which can accumulate to a postgraduate master's plus a PhD for lecturing and practice. Then you have the med school proper, in which you have a 4-year electives, then a full fellowship, please. A fellowship is a postgraduate medical training, which is more than a PhD, because it's a pure theoretical practical course, plus clinical training. So you now have a fellow, either preferably in these specialty courses, vis-a-vis family medicine, internal medicine, or community medicine, before a 2 years master's program in African traditional medicine.
She also emphasized that harnessing herbal and orthodox knowledge into medical curriculum in secondary and tertiary institutions in Nigeria will help the prospect of engaging training on modern facilities before certification, both in administration and otherwise.
Challenges, they'll be potent, they'll be multiple, they'll be diverse. That's natural when you want a good thing. Why? It is a good thing to channel the health of the populace to a primordial level. And I'll echo Sonia Shah. Applying Western standard of care to everyone is unrealistic and unethical, yes. But I'm sorry, in less than a year, I've now accepted this. This time last year, I will not be standing here and be defending African traditional medicine.
Contributing to the discussions, a lecturer of traditional and herbal medicine at the University of Ibadan, Dr. Femi Jegede, speaking on the important role herbal practitioners play in healthcare, said recognition and placement of practitioners, especially in primary healthcare, needs to be intensified. He also spoke on the need to properly professionalize the discipline through training.
The question is very clear and very, very germane. How do we truly professionalize the practice? It doesn't look like it's a profession because it's not properly coordinated, it's not properly guided. And why? Because there's no adequate training. People have not been exposed to the subject from the very beginning to the end. For example, I teach traditional medicine in the university. At the master's degree level, it does not exist at the 4th degree level in any university in Nigeria for now. And at our own university, people with any kind of degree can come in. People with BA in history, BA in geography, even BSc in engineering can come and do a master's degree in traditional medicine.
If you are going to deal with human beings, you just have to do a health-related course in the university, vis-a-vis biochemistry, microbiology, and all that. I'm not going to do theater arts and come into and I say I want to do masters in traditional medicine. No, you can sign an oath, a legal oath, and say, okay, I just want to do it because of doing sick, but it's only for my own knowledge. But anything to do with touching human beings, please, you must have that foundation of medical school.
Yes, as I know, I totally disagree on the issue that you must have the basic medical training before you can start teaching people, touching patients. I totally disagree on that. Because WHO has given us a definition, emphatically, on which a traditional medical practitioner is. And it was well defined. He said, a person recognized by the community in which he or she lives as competent to provide health care by using vegetables, which means herbs, animals, mineral substance, and certain other methods. These methods are based on social, cultural, and religious background. So, telling people now that they have to go back to medical school before they can touch people, it is not totally right. So it was when I was doing medical anthropology that I saw there are a lot of old views about health. And because in medical school, we were given a narrow confinement of talking about diseases, we were not taught what is health. Professor Rason-Kuti gave us this. He said, the decline in the fortune of medical profession in the eyes of our people has given traditional healers a field day and has won them a recognition far beyond their dreams. Traditional medicine is part of our heritage. It served our fathers well and continues to be trusted by majority of our people. Its language is understood and the verdict accepted, even when it records highest mortality rates in every sphere of medical practice. We cannot hope to supplant it by condemning it. Rather, we must strive to incorporate scientific principle into traditional medicine. We must begin from where our people are and evolve with them. We must evolve with them. And he further said, at present, scientific medicine is practiced in hospital, where we congregate ourselves, because most of us will stay in the hospital. We expect people to come, diseased people, to come and be meeting us, people that are sick. But we are not going to the community, as the traditional practitioners are in the community, monitoring what is going on within the community. And traditional medicine predominates in the community. We can either abandon the community to it or work with the system to modernize it. Our antagonism to traditional medicine is the result of our hospital-oriented medical training, which set us apart from the community.
Also contributing, Professor Maurice Iwu spoke on the issue of nomenclature, saying that at the continent level, there is a standardized scientific nomenclature for African traditional medicine that should be adapted. He said there is need to capture the success of herbal traditional practice in Nigeria and called for the issues of lack of data in the sector to be addressed.
There is only one medicine. Whether it's just one medicine viewed from different points. So isn't it self-defeating if we say that African medicine is for the poor? But because it is available, it is cheaper. And all that, all those whole nomenclature issue comes in.
Other participants also commented on the deliberations.
Perhaps tending on the negative side is when we ever put, maybe we want to advertise Africa, or we say African dress, African doctor, African dad. I don't hear European medical practitioner, European traditional medicine, American traditional, I don't hear it. Why do we want to emphasize Africa?
So I don't have the statistics, but I know that most of the births in Lagos State, even in Nigeria, especially Lagos where we work, we see that most of the deliveries of mothers are taken by traditional birth attendants. So how do we include them? Because going through the model, most of what we see is already in the schools. So what about those who are not in the schools, especially these women? The traditional birth attendants, they are the ones I'm most concerned about, because they are also practicing, they are herbal medical practitioners. They take deliveries using African traditional medicine. So how do we include them?
If someone is standing on 26 years experience as a doctor, I think I know what I'm saying by insisting that if we're going to have African traditional